The natural reservoir of Ebola is probably bats, probably horseshoe bats of some form. These bats transmit the virus between themselves, but periodically it then ends up in probably primates or other types of bushmeat, which are then hunted by villagers, and the virus is then transmitted either during the capture of the animals, from the sick animals being transmitted to humans. So it's human interactions with the environment and animals in the environment that the outbreaks occur, and these occur infrequently. From about 1976, when the virus was first identified, there have been periodic outbreaks. It's transmitted by blood and blood products and direct secretions from humans. So, for example, the liquid that bathes your eye, for example, semen it's transmitted in. It's been demonstrated to be transmitted sexually, but primarily via blood. And so direct contact is the route by which the virus is transmitted from human to human, and therefore barrier methods that prevent that direct contact, including things like washing of hands and things like that, provide a reasonable level of protection. It is not aerosol transmitted. I think you have to realise that this is just one of a whole spectrum of emerging infectious diseases which are being transmitted very much more efficiently with international air travel and international travel generally. And there's been a long history of this. The SARS outbreak 10 or 12 years ago was transmitted to 5 continents within a few months. Primarily because of international air travel. So this is something that we are not unfamiliar with, and that there will therefore be checks and balances in place to look for likely incursion of the virus into the UK. Of course, we should be worried. You have to remember that patients with overt symptoms of Ebola are extremely sick. A virus that causes this level of mortality, something around 60 or 70%, makes the patients extremely ill, and they're unlikely to be able to get on a flight in the first place if they're that ill. It's only treated in a supportive manner. There are no antivirals that are licensed to use against Ebola. There are no vaccine to prevent infection. So the methods that we would use would be, barrier protection methods to prevent people being exposed, isolation of patients and things like that. You have to remember that this is the largest ever outbreak with 1,200 or so cases. And as a consequence, the demand, if you like, the global demand for vaccines or antivirals is actually very small in comparison to other virus infections, which might, hepatitis C, for example, infects 170 million people. So vaccines and antivirals are being developed in the laboratory, but to get them from there to something that will go into the clinic, something that will go into patients, is a very long way off.